way over time. I was actually supposed to log in and address you about an hour ago, and I had barely arrived, huffing and panting at the hotel when I discovered you were running rather late, and I'm sure that no one wants to stay as long as perhaps we had initially thought they might. So we'll try and have an abbreviated session, and I will offer a very brief overview of some of AQA's key interventions in India so far, because I've been involved from the very start, present at the creation, as my good friend Shazia will testify, and why I believe these are important before we open the floor to the interactive session. So let me thank the Honorable Harry Dijnhoven and the Honorable Satya Vidya Yudha for their earlier contributions. From AQA, we've got Shazia Rafi, the President and Convener, and my dear friend of many decades, I think neither of us will want to admit how long, and the Honorable MJ Nolan, the Treasurer, who've all been stewarding this discussion, and I'm really grateful that you have come in. We've taken advantage of the webinar format to assemble such a distinguished gathering from around Asia and around the world to focus on this discussion. Now, very simply, our flagship program in India, since the inception of the whole AQA effort here, which was 5 years ago now, has been the annual Roundtable Series, which has been convened annually and grown considerably from its genesis in the first closed-door edition that I had convened in July 2017. And so we started about 5 years, just under 5 years ago, had the first meeting in July. I brought together civil society stakeholders, technical experts, communications professionals, and even senior healthcare practitioners, like the current director of the All India Institute of Medical Sciences, into a discussion on how we could collaborate and develop a comprehensive strategy to address India's crisis of toxic air. But I'll be very honest and say that initially, we didn't indeed get enough of a buy-in from a very important target element, namely the parliamentarians, the legislators, who are so key to finding solutions to this crisis. This is a critical stakeholder group as interventions are vital, and the political class had to that point remained largely apathetic to the issue of air pollution, which was confirmed, by the way, when a large number of those I invited failed to show up. So I had an excellent 100% turnout of all the experts, the doctors, the healthcare people, the NGOs, civil society, and a very modest, I think 3 MPs showed up at that first meeting in 2017. Now, we have now been able to make a lot of progress in that area. We've expanded the platform, we've roped in more parliamentarians and even government officials, and today we had the chairman of the Parliamentary Standing Committee. Last 2 years, we were able to get the Minister of the Environment, and by working closely with major actors like the Observer Research Foundation in 2018 and the Energy Resources Institute, TERI, in 2019 and 20, we've really made good headway in producing a broad enough umbrella so that federal parliamentarians cutting across the political divide have come to the table to discuss the issue of clean air. And at the same time, frankly, the issue itself has been gaining in salience in India, so that our efforts in some ways were ahead of the curve. Now we are surfing a very big wave that I think we can really take to the top of the public policy agenda. Now, we're also acutely aware of the need to improve the engagement of legislators from our states on this critical issue, because we are a very big country and implementation of environmental policy cannot all be done by the union or central government. And in our current air quality strategies, state administrations and urban local bodies are in many ways the heartbeat of our efforts and must be empowered to lead the campaign for blue skies. So in 2020, we launched the first of its kind state-level forum for local state-level legislators in the state of Chhattisgarh, and the leadership of my good friend Sri T.S. Singhdeo, the current State Minister for Health. And we got together a working group of 11 MLAs, including the sitting Minister for Environment and the sitting Minister for Revenue. This gathering was extremely useful, and we have really a lot to do to build on it, but it's actually essential for us to focus on that way. The other thing that we've tried to do much more on was to focus on legislative advocacy. Both at the state level gathering and the national roundtable, we've realized that utilizing and improving the scope of legislative advocacy at both the national and state levels, and in many ways becoming a bridge between the great technical expertise that exists and the civil society's work on the one hand, and legislators on the other, is indispensable. Now, all across the world, we have several tangible instances. Forgive me, let me try and see if I can organize some water for myself. My apologies while we're doing this. We have tried very much to get legislators to drive policy on issues related to climate action, as well as particularly air pollution, which is our number one priority here. And we've got parliamentarians who played a driving role in such fields elsewhere. For example, in the British Parliament, we've had the new climate change levy that was introduced in April 2001, which was a tax on energy delivered to non-domestic users in the UK, like industries, commerce, agriculture, and public administration. Now, that came out of the process, out of the actual parliamentary process. Similarly, I think Shazia today has already shared other examples, including from the Philippines and the European Union. But in India, to be very honest with you, the issues of clean air, and one could even argue the larger issue of climate action, has largely been the domain of judicial action and civil society-led activism. And even something like the new National Clean Air Program hasn't really been implemented effectively. There are real questions that people like me have raised regarding limited funding for the initiative, the small number of cities that have been included, given the scope of the problem we're facing, the capabilities of policy to enforce compliance. I gather that Jairam Ramesh, who inaugurated today's meeting, highlighted that enforcement is practically non-existent in India. So all of these gaps that we have been pointing out between policy articulation at the top and ground realities at the bottom, these are the kinds of gaps that legislators, both at the state and central level, can come together to address. But sadly, they haven't been doing it. And this is the opportunity that we believe we very much need to seize. The lack of engagement by the political class is a challenge for us. If we're going to campaign for clean air, which is what AQA has been doing for the last few years, then we really have to move faster than we liked. And what's good, as Jairam has mentioned, is that awareness among the political class is gradually beginning to grow. The sort of famous green shoots everyone likes to talk about appear to be appearing. And in the post-pandemic era, we really have to push this through. There's been a real impact, I think, of the growing research on air pollution and COVID-19 morbidity. I mentioned this in my speech in Parliament on in the one clean air debate we've had in the lower house. There was research by Harvard's T.H. Chan School of Public Health suggesting that the lethality of COVID-19 is exacerbated by air pollution. And they took data from 3,000 counties in the US that even a marginal increase in long-term exposure to PM 2.5 have contributed to a higher fatality rate amongst those affected with coronavirus. So given that, it is absolutely indispensable that we try and bring that lesson home in India, where the much greater concentrations of PM 2.5 and frankly the higher COVID fatality rates may not entirely be unconnected. There's been, as I said earlier, a beginning of a mindset change within the political class. We all realize that public expenditure on healthcare is too low, and that healthcare expenditure is also exacerbated by the horrendous toxicity of the air we breathe. If the voters and the public representatives can both recognize the value of health as a public good, which they've done so because of COVID and the hospital bed crisis, the oxygen crisis, all of this have opened people's eyes to the public health challenge, then I think they can also be persuaded to engage with issues like clean air. Because if we have cleaner air, we might have less of a public health crisis as well. So this enhanced willingness to engage in matters of health, personal well-being, and the environment is where we need to take this forum. And I believe there's growing recognition that the silent killer of toxic air affects us all, no matter which part of the country we come from, what political and ideological affiliation we may have, or indeed what socioeconomic class we find ourselves in, because the rich don't really breathe much better air than the poor. They can afford air quality, they can afford air purifiers at home, but when they step out, it's to breathe the same air that everyone else is breathing, and they have a stake as well in finding solutions. Now, I've been informed that a number of young parliamentary aides have logged into the session and that this is their turn to have an opportunity. So let me just say that I know all of you have a vital role to play, because I know how my aides have helped me in supporting my work in developing policy positions on clean air, and I hope that all of you will support the legislators that you work with on the substantive matters that have been discussed during the strategy session today. My own legislative aides, John Koshi and Gautam Ganesh, have joined, and Gautam has joined my office after extensive experience in a green tech startup. So he's able to bring some of his own knowledge and experience to my work in this area. John has been assisting me since the beginning of our involvement with the clean air issue nearly 5 years ago. And I'm sure each of you, with your own policy backgrounds, can help us take the conversation forward. Now, I have a message telling me that given the very late hour, we are way beyond when we should have closed, that perhaps not everybody will have a chance to speak. I was told that Ritika Jaju, Pallavi Baraya, Aradhana Gupta, Tanisha Sudarshan, and Vikram Venela Kanti were all on standby. Would you all mind very much if we at least ask the first three to give us a few initial remarks, and then let's open it up to the interactive when perhaps the other two might perhaps chip in and comment on the first three, because I don't know if we will have time to give everyone a voice. Is that all right with everybody? Shazia, do I see you nodding? Or have we gone well over the time limit? I see Harry nodding.
No, I think it's fine, because this kind of an opportunity doesn't often come where we have parliamentary staff and experts together. So please.
Good. Well, Ritika, then let me give you the floor. I think you were the first on my list.
Right. Thank you so much for this, sir. I work with Mr. Jayant Sinha, who in the previous parliamentary session, in fact, submitted a private member's bill talking about net zero commitments for India. So I'm just going to start with that first and just open up the debate on how net zero commitments have been, they've been considered basically as a debate between development and sustainability, and how these two aspects are not, they're taken as mutually exclusive, whereas these two should be going together. This is what the concept of sustainable development is all about, right? So talking about that, I mean, should India not be committing to net zero as maybe a target and then having smaller milestones that get us there? So the problem of net zero is not that we don't have the capacity to get there. It's that we're not committing to a capacity to get there, which is why we require a body that's going to take care of that, which is one aspect of net zero. And the other aspect of net zero is the development side of it, which is that development through sustainable development and talking about sustainability can also get us a lot of opportunities for our economy. So why not commit to net zero? And why not just create mechanisms and to get there? That's one aspect of it. And the other aspect, for me personally, I believe that the topic of climate change and specifically air pollution should really transcend boundaries. It shouldn't just be about one ministry taking care of everything. It shouldn't be about one stakeholder group or one agricultural group talking about stubble burning. It's not about one ministry or one stakeholder group. It should transcend boundaries. We should have all ministries incorporating the green agenda in their national policies. We should have ministries talking about the green goal in everything that they do. That's the one part of it. And when we're talking about legislation, we talk about the Air Quality commission that was formed for Delhi NCR recently, we look at the ministries that are integrated into the commission, and we see that there's a large gap. We don't have the Ministry of Health involved. Air pollution as a concept, air pollution has consequences on health. So why not have each and every ministry talking about air pollution? Because it's not just road transport and highways, it's not just agriculture that gets impacted. So these are my 2 cents on the problem, sir. Thank you so much.
These are very, very impressive and accurate and valid points. I do want to stress that while we can aim for net zero, we really do have to think seriously about actionable steps all along the way. But I will welcome comments from others. Let me just give a floor to Pallavi right now, who I think is on standby. Pallavi?
Hi, thank you.